All right, we are live.
Hello and welcome. I'm Elizabeth Heltman, the field manager with Moms Clean Air Force Michigan. We are pleased to welcome everyone to our Black History Month Environmental Justice webinar, sponsored by Moms Clean Air Force and Michigan Clinicians for Climate Action. Moms Clean Air Force has over 34,000 members here in Michigan and over 1.5 million nationally fighting for clean air and climate action for the sake of our children's health and future. According to the American Lung Association, Michigan has one of the highest rates of asthma in the country. We have 12 counties with failing air quality grades, including Wayne County. The city of Detroit has asthma hospitalization rates significantly higher than the state as a whole. Childhood asthma rates are significantly higher for children of color. Black children are 10 times more likely to die from asthma than white non-Hispanic kids. Children who live near power plants, oil and gas operations, high traffic highways find their chronic illness are exacerbated by pollution. Detroit is notable for its numerous large industrial pollution sources and has many large neighborhoods and schools adjacent to large industrial facilities. Moreover, about 69,000 Detroit residents live within 150 meters of a major freeway, and 58 Detroit public schools with an estimated 24,490 students are within 200 meters of a major roadway. All major sources of pollutants such as soot or PM2.5, as well as known as NOx. Studies have shown that PM.25 disproportionately affects people of color in the United States. We will be discussing these environmental injustices with our esteemed panel, U.S. Congresswoman Rashida Tlaib, Dr. Lisa Del Buono, President of the Michigan Clinicians for Climate Action, Sandra Turner-Handy, Special Advisor to the President of the Michigan Environmental Council, and Wayne State University medical student Taylor Barrow, MS. It is my pleasure to introduce the Congresswoman Rashida Tlaib, who represents the 13th Congressional District, which includes the city of Detroit and surrounding communities. Her two sons are at the root of her unwavering passion to help change lives for the better. She is the oldest of 14 children, born and raised in Detroit, and proud daughter of Palestinian immigrants' parents. The Congresswoman made history in 2008 by becoming the first Muslim woman to ever serve in the Michigan legislature. She is beloved by her residents for the transformative constituent services that she provided and for successfully fighting the billionaires and corporations that have tried to pollute her district. Welcome. Congresswoman, you've been a climate champion your entire career, from the time in the State House as well as in Congress, especially on environmental justice issues. You've introduced bills to protect frontline communities like the one you represent, which suffer from some of the highest asthma rates in the country. Studies have found that Black and Brown communities are exposed to disproportionate high levels of particulate air pollution, also known as PM.25 or soot. In addition to this, communities often lack infrastructure necessary to handle flooding and extreme heat events, made more common by climate change. Can you speak about your environmental justice work and the importance of the Biden Justice 40 initiative?
Sorry, y'all, I'm not using my laptop. I'm in the back of a congressional hearing. We're voting on some amendments, and so I'm joining you all in the middle of a really important week, but I had to come together because, as you all know, I grew up in Southwest Detroit where I thought that smell was normal. I thought, you know, the trucks roaming through our communities and a number of my classmates having asthma was normal. And, you know, you all know, as Moms Clean Air Force, as well as the Michigan Clinicians for Climate Action, you all know that it wasn't normal and that it also impacted, you know, many of our communities that were struggling with children in academic areas, mental health, and a number of things that really contribute to the overall well-being of many of our families in our communities. So thank you for inviting me to honor Black History Month, which Black History Month is American history. I like to remind folks, I think it's a constant reminder. Communities of color, you all know, and low-income communities have historically been subjected to disproportionate amounts of air, water, and soil pollution. And as a result, we know we have these high rates of increased adverse health risk. I just got with the Great Lakes Law Center an op-ed published about, the fact that Detroit deserves stronger ozone protections. Right now, it has been really hard to try to, again, have some sort of oversight and saying to EPA and Eagle to making sure, again, that they're not going, that they go far enough to, again, protect our air quality. And so that op-ed really narrows down that importance, especially, again, for many communities that have been fighting on this issue for a long time. I'm in the school of thought, when we say children can't learn if they're hungry, I also believe children can't learn if they can't breathe clean air. And so last year I introduced legislation called the Cumulative Impacts Act, which would create critical protections for environmental justice in frontline communities overburdened by air and water pollution. Folks, and a lot of my residents don't realize this, when we look at one company that applies for air permit, y'all, they don't actually collectively look at how the output from other nearby corporate industry combine what that impact is on our public health and environment, unfortunately. And so this is something that we've introduced, as well as it's part of the Environmental Justice for All Act, which did get out of subcommittee, out of our Committee on Natural Resources last year, but unfortunately never reached the floor for a vote. But it would require Environmental Justice for All Act would require the EPA to analyze cumulative impacts and permitting decisions, which again is something that our communities have been asking for in Southeastern Michigan for a long time. And also deny permit applications. I mean, I think it's okay. It's time to say enough instead of continuing to renew and expand something that we know is hurting our communities. And you all know corporate polluters have poisoned Black, Brown, and Indigenous and low-income communities, overwhelmingly putting profits over people's lives. When I saw data that showed more of my Black neighbors died from the pandemic than any other community in Michigan, even though my Black neighbors' total population in Michigan is less than 14% or something like 14%, 13%, something between 13 and 14, they died at a higher rate because of pre-existing conditions, because again, they're in communities that are surrounded by corporate polluters with respiratory issues and a lot of other pre-existing conditions. Again, with the pandemic worsening it, we lost so many, again, of our Black neighbors due to that. We know that corporate polluters, for them, a lot of the violations that we continue to see from fines and penalties is not enough. It's just the cost of doing business. They actually budget for it. They're never made to pay for full cost sometimes for the pollution. And they get into these agreements with the Department of Justice when they do go far and they say, look, we got to come together. And they end up coming with these agreements that sometimes lack transparency. Communities are not involved in negotiating these consent decrees and again, trying to hold them accountable and to address the harm that they caused our communities. But in the end result, with all the agreements I've seen in the past, 200 plus public hearings I've attended on air permits, Detroit still has the highest asthma rates in the country. And the racial disparities are only getting worse. Wayne County, which is the largest populated county in Michigan, has been out of sulfur dioxide attainment for a decade. And, we continue to struggle, with how they're calculating ozone attainment and so forth. And even their monitoring process in the state is failing us. And Detroit's own 48217 zip code, which, if you go over there, they're completely surrounded by industry, steel industry, petroleum, oil refinery, a number of industries around there. In the last 3 years, 28 permit violations have been issued in just one community, in that particular community. And they continue to advocate, they continue, it's so hard because they continue to say, why are you sacrificing our community? They call themselves sometimes a sacrifice zone. And so that's why it's really important as we talk about President Biden's Justice 40 initiative and other things about implementation and the fact that frontline communities like this who have suffered for far too long need to be at the forefront. And, I'll say this, I've said this to the president and many folks in his administration, we pass bills, but implementation is key. And that's where groups like yours and others can come into play, because we can't wait for another day to repair the damage of disinvestment. And we need to deliver these funds directly to environmental justice communities, like I talked about, those that again have continued to suffer for the lack of, real accountability. My office continues to partner with a lot of these groups sometimes even helping share information of how to submit comments for permitting, which is also very broken. I mean, a lot of folks want public hearings so they can be able to ask questions, orally versus, going online, submitting it online. That's, again, for a community like ours, it just doesn't work. So we're always consistently asking our state agency to have public hearings to address that. So Justice 40 initiative, I'm watching it. Implementation matters. These are great ideas, but I promise you, great ideas can remain great, but they can be fantastic and really exceptional if it actually does do what it is intended to do, which is address a lot of these harms. But I'm so glad as you guys came together in this thoughtful way, as we talk about our history, our Black history, that we understand how environmental injustices and environmental racism plays a role. And again, watching so many of my neighbors die and continue to suffer from long COVID because of pre-existing conditions due to the fact that their communities were targeted by corporate polluters. So I commend all of you for, again, bringing us together in this important panel discussion.
Well, we want to thank you for your passionate work to protect your constituents in the 12th district and as well as our planet. The next question I have is for Sandra Attorney. In addition to the 10 different advisory boards in Detroit, Michigan, Sandra is the special advisor to the president on the Michigan Environmental Council. She focuses on environmental issues, environmental justice, and public policies within Detroit and beyond. She engages Detroiters on environmental issues and connects them to Lansing. She represents the Environmental Council on various governing bodies and in community development efforts. She mentors staff on engagement, justice, and Detroit policy. Welcome. As a longtime Detroit resident, sharing with folks the disproportionate impacts of soot and particle pollution in Detroit residents has always been a central part of your work. Can you tell us a little bit more about your role in Michigan's Environmental Council? Looks like we may have lost Sandra there. Well, I will move on and hopefully she'll be able to join us here shortly. I will turn this over to my next question, which is for Taylor Barrow. I'd like to pose this question to another Detroit resident and third-year medical student at Wayne State University. In addition to your advocacy for Clinicians for Climate Action, there has been a history of disproportionate health impacts of pollution on Black children, families, and communities. Refineries and factories are near schools, parks, and homes. Can you tell us a little bit more about your personal experience as a longtime resident of Detroit and now a third-year medical student, what these impacts look like in your community and what would look like if we got this right?
For sure, yes. Can everyone hear me okay? Just want to make sure. I have a little heater going, so. Yes, thank you so much for that question. It has been quite a journey, I would say. So I was born and raised on the east side of Detroit, and I was, Jefferson Chalmers area. And so it is interesting now, having grown up on the east side, left, gone to college, come back, and now as a medical student. With having worked in the nonprofit sector as a social worker for a number of years, it is just it's almost a bit jarring, just how much kind of goes into our health. And, starting to gather this language around health, around environment, something that I've always been passionate about. It's what really I kind of keep circling back to is this notion, and I think Representative Tlaib hit it on the head. What is a pre-existing condition? And what is that? What does that mean? What does that mean from a medical standpoint? What does that mean from an insurance standpoint? What does that mean from an environmental standpoint? And I realized, my experience, it has really taught me that when I want to be the physician that I want to be, understanding the notion of a pre-existing condition being historical, being intentional, is very important. And it's very important in how I want to relate to future patients. And it's what I've seen in terms of my relationships with my patients so far. a pre-existing condition doesn't just start by when someone comes in and their blood pressure is high in the clinic, right? And we diagnose them with hypertension, or we diagnose them with asthma. I realized through my organizing work and just through living in Detroit and working as a social worker, this started so long ago. This started generations ago. Specifically, if you're talking about Black Detroiters, I think about my family history, right? So my relatives and my ancestors migrated to Detroit from the South during the Great Migration, when a lot of Black families were leaving, essentially refugees in their own country, but had to leave the horrible conditions of Jim Crow South, and they fled to a northern state, which wasn't that much better, but at the end of the day, it was for a better life. And so it's interesting because that is the start of like how I got here. And it's under that stress, that generations of stress, what doesn't it make sense that we would have some sort of high blood pressure, right? If you're fleeing and all you know is just this rampant just hatred and this rampant violence, and you try to come to an area in which you can, escape that and live out the rest of your days, and you raise your family and you raise generations under this constant threat of, okay, I'm not really wanted anywhere. Right? Because we have the legacy of slavery. We have this legacy of generations ago. I can go back a couple of years and I'm going to hit a brick wall in terms of who I know as my ancestors because they were enslaved, they were property. And so that all kind of goes into, fast forward to me today, entering into the medical field and learning about these pre-existing conditions and learning that, to be honest, the environment was very much determinant of what our pre-existing conditions were, right? Whether it's the stress of having to leave a Jim Crow South, whether it is coming to Detroit, establishing a wonderful environment like Paradise Valley, like Black Bottom, just to have that also siphoned from you, right? To have that strategically removed from your legacy. There was an established environment here where you did have Black folks coming together and creating community that they thought was sustainable. But then here you go, the powers that be were more interested in taking a profit from that. So they built a freeway. That's where 375 is today, is at the heart of Black Bottom, at the heart of Paradise Valley. So again, what goes into the name of pre-existing condition when all that was your entire history was you tried to find this sense of safety. You tried to build this community, this healthy lifestyle, but again, it gets taken from you because inherently you're not wanted there, right? You're a resource at the end of the day. And so coming into medicine, I'm only in my third year, so I still have a long way to go, everyone. But when I interact with patients, particularly in the city that raised me and where my ancestors are from, I keep all of these in mind when I'm treating folks for asthma. I think Representative Tlaib also alluded to the fact that a lot of kids grow up right next to a big industry. I grew up on the East Side, and I thought I thought everyone had a huge automotive plant right down the street from them, right? And we talk about specifically on the East Side, the Chrysler Stellantis plant. I used to be able to ride my bike down St. Jean, which was used to be a greenway, right? You could cut right through, and there was a restaurant on the corner that we used to go and get milkshakes from, and that's no longer there because the plant was expanded. And so again, it's this legacy of wanting to build an ideal environment, but what does it look like when your environment is always meant to essentially give you this sort of pre-existing condition, right? Always meant to take away some autonomy that you have on your health. And I think when it looks like getting it right from a clinician or a future physician standpoint, I think it really means to kind of delve into that notion. Okay, I know that I'm working with populations and I too have these pre-existing conditions or I have these health concerns. What's the social, political, and historical context for that? How can that be incorporated into my treatment? And it's one of the reasons why I got involved with MICA. I've been doing a lot of other initiatives to sort of understand the community aspect of what it means to be a healthcare provider. Because at the end of the day, our health is not going to get better if we don't actually have physicians and all people of the community advocating for these historical pre-existing conditions, right? These historical inequities that folks from my particular community have a legacy of. And I'm not even speaking about just my parents, right? It's my grandparents, it's my great-grandparents. We all have lived here. We've lived in the city of Detroit until my great-great-grandparents migrated from the South, right? And we all have this legacy of moving to a place where we're trying to establish autonomy, where we're trying to live our best lives. But that is time and time again sort of siphoned from us strategically. And then we get blamed for the fact that we have high anxiety, we have, hypertension, we have asthma, and it's like we're sicker, we're not living up to these expectations of health, but that's not the reality, right? The reality is health is constructed by your environment, and it's so important to be able to advocate for it and have a voice in it. So I think when it comes to getting it right, it's having clinicians be community members, have community members feel safe with their clinicians, having our legislators all be in conversation for protecting communities like mine, so that we can kind of stop this historical wheel of, trying to find the safety and then have that safety taken from us. So, thank you.
No, thank you for sharing a little bit about the history of disproportionate impacts, as well as your personal story. That does make a huge difference in conveying what we're trying to get out here today. I would like to turn it now to Sandra. Thank you. I'm sorry we lost you for just a moment. But my next question is for you. As a lifelong Detroit resident, sharing with folks the disproportionate impacts of soot and particle pollution on Detroit residents has always been a critical and central part of your work. Can you tell us a little bit more about your role on the Michigan Environmental Council?
As the engagement director, I've always worked in the city of Detroit. And if you work in the city of Detroit around anything dealing with the environment, you have to deal with environmental injustice. It's just a reality in the city. We're a manufacturing city. Rep Tlaib, she represents an area where there's so much pollution, and the largest steel mill that was in the state of Michigan, Marathon Oil, Detroit wastewater sewage plant, and other industry that have always, and I won't say the word pray, but have preyed literally on the residents in the city of Detroit. We're a manufacturing city. We've always have been. We sit on the Detroit River. We have to remember that back in the days when there weren't cars and streets, that everything was shipped on the Detroit River, meaning that that's where the factories sat. And living in the city, we've learned anything close to the river is going to be contaminated, because that's still where a lot of the factories sit. And a lot of our residents, including my parents and others, we located in Southwest Detroit. The Ford Foundry was there. People walked to work. People didn't live far away from work. We didn't have cars. So they either walked to work or caught a bus to work. So we lived in community with these factories. And I tell people, because I've experienced, a child with asthma in the city with the incinerator. And so I can imagine prior to my time, how people dealt with these illnesses, high rates of cancer, high rates of asthma. In Southwest Detroit, they wake up to soot on their cars. I mean, they have this film dust sitting on their cars. How do you live with that? And you allow, and our children whose respiratory systems are not fully developed, but they're inhaling all of the soot and other things from these polluting facilities. I've fought for so many years as a member of the Michigan Environmental Council. I fought for so many years to close down our waste incinerator, our solid waste incinerator, largest in the country at one time. And literally sitting across the street from an elementary school. We have kids in the school 4 and 5 years old that are inhaling all of these toxins from this facility. And we're fighting. We're trying to find every way we can to stop this. So we develop curbside recycling. Oh, that's less going to the incinerator, less that we're gonna feed the beast. Well, the city said, well, not the city, but the owners of the incinerator said, that's okay. You don't want to send us your trash? We're going to the suburbs and we're gonna get that trash from the suburbs and bring it into this community of color. And we're gonna continue to burn it, and we're gonna continue to impact the health of residents in this city from trash coming from outside of the city. It's environmental racism, environmental injustice. And once the incinerator closed down, we went back to landfilling, and which means that even in the city of Detroit, we have taken our solid waste and put it in someone else's backyard. We have to start looking at how we literally handle our waste products so that we are not impacting communities. And it doesn't, at this point, everybody's being impacted because it seems like there's been a rush on just whatever goes with the environment. Anything goes at this point. We talk about climate change and we realize the impact that it's having on communities. And believe me, yes, it impacts vulnerable communities more because they're the least able to recover. They don't have the resources to recover. But our last flood went across Metro Detroit, and meaning that many people were impacted. So when we talk about soot and we talk about the impacts on health, I have to tell this story that my granddaughter, healthy, 14-year-old cheerleader, bouncing around, so much energy. I sent her to a school right across from the incinerator, which sat right on I-75 and I-94, the most traveled freeway intersection. Then we have the incinerator. She developed asthma, in and out of the emergency room at Children's Hospital just consistently. It was days I didn't know if she was going to recover from one of those asthma attacks. She recovered. She is now 30 years old, graduated from that school, went to high school further in the city, has never used an inhaler since she was 14 years old. Now, you guys tell me the impact that we have on our children when we don't have people making conscious decisions around their health. Because what that winds up being is they become my age with a lot of underlying conditions because we didn't take care of them to start with. We did not bring industry into attainment and really support green industry and renewable energy. So all I can say is that Rep. Tlaib, you're doing a great job, and we just need to get everyone in line to understand that the health impacts are what really set us up for the pandemic. It really set us up for the loss of life that we've had in Metro Detroit because our built environment is not conducive to public health, period. And I hope I answered your question.
Sandra, you're always wonderful with connecting your personal story, your advocacy, and the connections that we need to speak up and be a voice. And I really appreciate you sharing your personal story as well as your advocacy with this group here. And last, I just would like to turn this over to our co-host today, Dr. Lisa Buono, the president of Clinicians for Climate Action. Lisa is a medical doctor who practiced in Traverse City with an expertise in GI and breast pathology. In 2020, she founded the Michigan Clinicians for Climate Action with a desire to utilize the trusted healthcare voice to educate the public and policymakers about health benefits of addressing climate pollution and change. Thank you, Lisa, and I'll turn this over to you.
Thank you, Elizabeth, and thanks to each of the panelists. You know, your stories are incredibly moving, and I can't thank you enough for sharing them here today. You know, according to the World Health Organization, worldwide, about 7 million people die each year of a combination of indoor and outdoor air pollution. That's similar to the estimated total number of deaths that have occurred over 3 years due to COVID. But air pollution deaths occur every year and have been occurring every year for a long, long time, and disproportionately impact these communities of color, like here in Detroit. In the US, the Clean Air Act has gone a long way towards improving the situation for many Americans, but still, according to the latest State of the Air report, 4 in 10 people live in communities where air pollution sometimes reaches unsafe levels. And people of color are 3.6 times more likely to breathe polluted air when compared to white people. According to a recent report from the Asthma and Allergy Foundation, Black Americans in the US are 5 times more likely to require ER visits for asthma and 3 times more likely to die from asthma. And if we bring it home to Michigan, according to the Michigan Department of Health and Human Services, the rate of hospitalization for asthma in Detroit is 4 times that of the rest of the state. So these are startling statistics, but really they only tell part of the story, because air pollution doesn't just impact our ability to breathe, as significant as that is, but it also correlates to a lot of these pre-existing conditions that have been mentioned here today, including memory difficulties in the elderly, an increased incidence of preterm deliveries and low birth weight and stillbirths in the US. And many, many people talked about COVID-19. There's an increased risk of dying from COVID-19, the higher your exposure to fine particulate matter. And that just is a few of the pre-existing conditions that are correlated with air pollution. Now, so far I have discussed the health impacts due just to air pollution, but when we take climate change into account, things even get worse, because climate change is a threat multiplier. Air quality gets worse as temperatures increase, and hot, humid days are becoming more frequent. If we think about Detroit, with the relatively little green space and tree canopy, you know, the areas in which there is relatively little green space and tree canopy, it doesn't cool down as easily. So that combination of heat and humidity and poor air quality are likely to trigger not only asthma attacks, but also exacerbate those pre-existing conditions and lead to things like heart attacks and stroke. Similarly, when we think about the ice storms that we have recently been experiencing, we know that those are becoming more frequent and leading to prolonged power outages. And that puts people who are dependent on medical advices that rely on electricity very much at risk. Now, there is good news here, and that's because climate solutions are health solutions. Whether you're talking about increasing people's access to healthy foods rich in vegetables, more walkable and bikeable communities with more green space, transporting our kids to school with electric school buses, all of these are good for both our health and the climate. It's a win-win situation in which all people benefit. But then if we look at the health benefits of transitioning to clean forms of energy that will clean up the air, the health co-benefits are immense, and it's only fair and true that it will improve the health of those who have been disproportionately impacted the most, as it well should be. Now, thanks to policymakers like Representative Tlaib, Congress has passed and President Biden has signed into law one of the most meaningful pieces of climate legislation to date in the Inflation Reduction Act. Now, implementation is key, and Justice 40 is key, as Representative Tlaib pointed out. This would not have happened without citizen engagement. People like you working with groups like Moms Clean Air Force. But there's still much, much more we can do. And one thing we can do right now is that the EPA is currently considering strengthening the standards for fine particulate air pollution. So that's one type of air pollution, the so-called soot standards. The EPA's proposal right now is not strong enough, but they're still accepting written comments up through March 28th. So we're going to drop a link in the chat and on Facebook where you can add your name calling for the strongest soot standards possible. So the bottom line is that climate solutions are health solutions, and you and I can be part of that solution by supporting the transition to clean forms of energy, which will clean up the air, improve health, especially the health of those who we've been talking about here today. Thanks so much. I'm going to turn it over to you, Danielle, to field any questions we might be having.
Hello, everyone. Thank you so much for being here. So I'll just read out a few questions that we got on our live stream as well as in this Zoom chat. And I would also like to thank everyone who left comments. So the first question is from Bobby Boyd. And it reads, do you believe that class is an important factor in shaping environmental justice values? And I'd like to direct this question to Congresswoman Tlaib, and afterwards, anyone who would like to answer, please feel free to comment. Thank you.
I'm so sorry. So the question is not one of those ones that are in the chat now.
The first one is, do you believe that class is an important factor in shaping environmental justice values?
I mean, if they're talking, absolutely. I think that is absolutely an issue. I mean, if you look at some even communities outside of our communities and rural communities, other communities, I mean, it's very evident that there is a huge impact. I've even talked to people like when we talk about even water shutoffs, which is, you know, to me, very much a form of policy violence to shut people off from water. But we had a woman out in Tennessee and a Black woman from like Detroit speaking about this issue in like unison. And it was very evident that what brought them together was the fact that they were both struggling with poverty because of, you know, various issues. Both have had generational poverty and haven't been able to elevate out of that. But yeah, absolutely. And that's something that we do talk about more honestly with environmental justice groups, not as much, I think, work with our colleagues here in Congress. I wish we did more together.
Can I add something to that, Danielle?
Yes, I do just want to let you guys know that I know the Congresswoman only has a few more minutes. So if possible, I would like to read one more question out before she has to leave, and then we could come back to this. So the second question is, thank you, Representative Tlaib, for your work on this issue. Something that gives me hope is the new majority in the state legislature. I'm very lucky to have Senator Chang as my local state senator, and I know she's an EJ champion as well. What should legislative priorities at the state level to make things easier nationally? What air quality policies would you recommend lobbying state and local politicians for?
I mean, I think, you know, I served 6 years in the State House, and I remember the processes around violations and accountability. I can tell you when I first got in, Granholm was the governor, and a Democratic governor, and I had saw in that budget 60%. So it was 60% cut within Eagle, which was called DEQ at the time. And so that meant less inspectors on the ground to do oversight in Wayne County. I think at that time we had 11. I don't know how many we have now. Why that's critical is that they come out as soon as we make that call to the odor line, or to, you know, we see a spill or anything, to have actual folks from the state environmental agency come down. One of the things that's also important for folks that are listening is much of what Eagle does is delegated from the EPA. But how they implement it on the ground, what that oversight looks like, that is up to, you know, the state house members and state senators can emphasize different kinds of measures. Also, look, I was there when, you know, at that time when Governor Snyder was there, there was a conversation around then the Severstall, or now was AK Steel, and now is, I think, Cleveland Cliffs, where they were going to deny the permit. And it was the economic, it was all exposed that the economic development section, the Michigan Economic Development Corporation, was weighing in on an environmental permit, even though at that time the state agency was going to recommend to deny it. You know, what recently happened on the state level in regards to ozone, I mean, I wrote in my op-ed, and I'm trying to be as graceful about it as possible, but I need our, leadership in the State House, State Senate to realize the rolling back and the trying to get around policies for, quote, job creation is going to hurt us in the long run. Many of these corporations and folks don't even stay long enough. They don't have there's no sustainability. They just leave us with more pollution and more health disparities and impact. So I think it's important to speak truth. One of the things that I've always said this, President Biden kind of came up to me, it was before he had gotten elected, and he said, I'm going to need you. And I said, absolutely, I'm going to fight like hell, but I probably won't be your favorite member. And he kind of looks at me. I said, because I'm on a different timeline. And it's very important to realize, you guys, that some folks are like, oh, let's just do this now. We'll get it done more aggressively later. I've learned that it doesn't work. This is our time. We've waited long enough. Like, how much more can we wait for more protections? And the other important critical thing, our president has been talking about equity within environment, like really true equity. They need to start evaluating, looking at how different projects where air monitors are in the state, where they're investing that monitoring and oversight. Because again, budget and the way they implement it is based on, that's values. Like, where are they emphasizing more support? And then lastly, Working Families Party reminds me, look, President Biden is like not our destination. What I mean by that is like, he's just the door. So right now, the Michigan trifecta, as they call it, that's your door. So if you're an advocate out there and you're fighting for Great Lakes, you're fighting for water, you're fighting for air, you're fighting for, clean soil to grow, all of those things, this is your door. Start knocking on the door and asking for more by our state government. And again, they can do more. And I've seen things like other states, I don't want to compare. I know California is different, but other states have gone and done more around that issue. New Jersey has done more around clean water. And so looking at other states who have gone farther in protection at the state level, could inspire us to ask for the same thing.
Thank you so much, Congresswoman Rashida Tlaib, for your comments today and squeezing us into your busy schedule. Do we have any more questions, Danielle, that you see?
Yes. Yeah. Thank you so much, Congresswoman. I think she has to leave now, but we really appreciate the time that you made out of your very busy schedule today. But I'd like to pass it back to Lisa. I believe you had a few comments regarding the first question about, do you believe that class is an important factor in shaping environmental justice values?
And yeah, I just was going to bring up, which I would guess many people on this call are well aware of, is the historic, legacy of redlining. Redlining was a class issue, and the fact it has made it more difficult for certain populations to gain wealth. But also, if you look at the mapping that goes along with the areas that it was harder to say the more desirable areas, the areas where it was harder for people of color to actually get mortgages back in the 1930s. Those are the areas that have more green space and less industry and less interstates. So this legacy of air pollution, which and dirty water and on and on and on, pollution of all types, really parallels that historic redlining that goes back to the 1930s, and it's made visible in these pre-existing chronic health disparities that people, if you study epigenetics, it continues through generations. So you can't really underestimate the power of that legacy. It's huge.
Sandra.
Thank you, Danielle. I just want to jump in and say you talked about our state legislature right now and the fact that we're in control of it. But when we talk about ego, and the rep mentioned MDEQ, we have to remember that our state department, environmental department, has never been an enforcer. They fine people. The fine is cheaper than correcting the problem, and it always has been that way. They are not enforcers, and they're still not enforcers. But with the makeup of our current state House and Senate, we now have the power to really put some support behind ego so that they become enforcers. I literally saw a facility that used their paper fines as wallpaper. And they continue to pollute a low-income community with pouring toxic wastewater down the sewer system. And it was coming up in people's homes. But it was easier to pay the fine than to correct the problem. And that's how the incinerator and other facilities like Marathon Oil and Zug Island, all of them got away with this because it's just easier to pay. You know, it's cheaper than correcting the problem. We got Stellantis right now, same thing. They're being fined. They're sitting in the middle of a low-income community and they're being fined, and they get months to correct the problem. But in the meantime, people are being impacted and they are having respiratory impacts. Do they have to die in the months that they're given to correct the problem? I mean, what do we do in the meantime to save lives? So we need to make sure that this current state legislature is supporting ego in a way that they can become more effective on the ground in these communities.
Thank you, Sandra. Before moving on to the next question, does anyone have anything else to add? All right, then going over to the Facebook live stream, one of the questions we got is, how can people get involved to work on these types of issues? And it seems like that question is open to whoever would like to answer.
I can answer. Just from my perspective, I think I saw a follow-up around like the science community as well getting involved. And I think it when you really take the time to understand, especially as a member of like the science community or even in academia, understanding that not only are you studying or practicing or trying to get this, I don't know, this goal of whatever your academic goals are, but also recognizing the community in which you're working in. I think by starting and just understanding, hey, turn on local news or turn on or listen to folks, you know, at your community gatherings, church, whatever, and actually do the work to not only just study the community, but be a part of the community that you're in is always the first step. Introducing yourself to other people, it is not difficult, especially in this technology age, to sort of connect with folks who might be interested in doing this work, but also might have the same complaints or the same perspectives as you might have. And I think specifically for the science community, I mean, there's so much that the science community does in terms of pushing legislation forward and coming up with new ways to sort of mitigate the effects of climate change. But I think specifically something that I'll speak for myself personally, that was kind of a culture shock in coming into medicine was just how like two different versions of Detroit that I was in, to be honest. I go to Wayne State, which is in the heart of Detroit. And I, you know, being in the academia world versus being a community member who's lived there my whole life, I find more times than not that the two didn't communicate on the same level in a way that I thought would be most sustainable. Oftentimes, you know, Detroit is sort of overstudied but underfunded. And I think in terms of when it comes to academics or folks who want to be more involved, it's just seeing yourself in the community that you're also working in and actually figuring out, okay, what are my impacts on this community, right? Am I here studying this community? Am I here trying to, you know, come up with this new technology or this new treatment or what have you? How does that impact, you know, the place that I actually am? And I think kind of just like having that, I would even say like humility, right? And understanding how do I fit into this fabric of community that I am is one sure way to get involved. And you might find yourself amongst people who are very much like-minded, which is how I found Micah, right? So yeah, just taking the time to understand, you know, what your impacts are and where you are, and the socio-political historical context of that. Is this the first step in really truly getting more involved, for me at least.
Should I
Lisa?
add something? Yeah.
Yes,
Well, first
go
of
ahead.
all, Taylor, you knocked it out of the park in that description. And especially, you know, Micah's focused on mobilizing health professionals, and the way you described trying to integrate your professional work to the surrounding communities is something I don't think that we do very well in medicine at all. And particularly at the doctor level, which you and I have served in. And, you know, I think nurses are much more in tune with the community around them, and I applaud them in their ability to do that. Going back to how everyday people can get involved, I've been really impressed by the work that Moms Clean Air Force has done and their ability to mobilize people to weigh in on the EPA soot rules, for example. That's my first experience with it. The turnout that they managed was phenomenal. And the way the people spoke was excellent, which means that they clearly were training everyday people to use their voices to affect political change. I've seen that through the Michigan Environmental Council as well. And I want to also give a shout out to the organization which got me started, which was Citizens Climate Lobby. Similarly, very grassroots, focused on the federal level rather than the state level. But I had never met with a member of Congress. I had never written a letter to the editor. I had never done anything a decade ago. And they took somebody completely unskilled, and now I feel very comfortable in doing that. And so if they can teach me, they can teach you. So I encourage you to get involved in any of these organizations.
Sandra, go ahead.
I just want to add that what I say to academia is that people believe in data, and academia provides the data needed for people to say, okay, this is really occurring. But what we need now is the advocacy to partner with academia to tell the story. You have to have a story that supports that data for people to really internalize what is happening. So I say the clinicians, nurses, doctors, even just researchers out there, tell the story, put it with the data. And then you go into these decision makers' offices and lay it out to them so that they can understand not only the data, but the fact that it is truly impacting lives. People are dying every day. And that's what we have to get people to understand. And that's where the advocacy comes in. So we need to partner with on the ground grassroots organizations that's doing the work.
And that's the power of your personal stories, which is so great that you shared them in connection with all the data and the information that we've learned about particle pollution, how it affects Detroiters, how it affects all folks in the United States, and it impacts folks in cities across our nation. I just wanted to say that there are ways to engage, not only at a federal level, but at a state level as well. We are working on electric school bus funding. There is some information you can find on Moms Clean Air Force website as far as getting your schools to apply for these funds to help get dirty diesel away from our children's schools and off these highways. As well as we're doing some stuff partnering with local folks in the state to increase those funding so we can get more electric school buses out there. In addition to the things that we just mentioned today, you can go to our website, like we said, at www.momscleanairforce.org, and you will find easy petitions and actionable things to do. You can also get a hold of your field managers in states. So if you're watching this from another state, we have folks all across the country here who are willing to help you learn to write a letter to an editor, to connect you with your politicians, to give yourselves a voice. As the Congresswoman said, that is the wonderful power that we have within our communities to connect with our politicians and make sure they're hearing our personal stories in connection to all of this. So I just would like to say thank you. We're coming up at the top of the hour here. So it is time for us to sign off. And if there's anything else that any of our distinguished panelists would like to say at this time, I will open the floor back up to you. And why don't I start it out with where we began with Taylor, and then we'll move to Sandra and then Lisa.
Awesome. I just wanted to say thank you so much for this opportunity. As someone who is very much still on this journey, like very in the middle of it seems. It's just really, really comforting and wonderful to be amongst folks who are doing the work and are essentially living examples for what I want to be, you know? So just thank you so much. And I really appreciate the opportunity.
I just want to say thank you for this opportunity to speak about this very important issue, and for people just to remember the built environment has a greater impact on the lives of residents because that's something we can control. So we have to control it in a way that we're saving lives and enhancing the quality of life for residents.
And I would just say, you know, I've been really humbled to be here among such beautiful people who can relay their personal history so beautifully. And remember, climate solutions are health solutions. You know, it's a win-win. So let's take advantage of this moment in time. Thank you.
Well, that wraps up our webinar for today. If you'd like to get a hold of anybody in our communications department, please reach out to Michigan Clinicians for Climate Action or Moms Clean Air Force if you have any follow-up questions that you would like to ask our panel here. Thank you so much and have a wonderful week.